I think it's partly about what works for us as individuals, but what works in the context we happen to be in our lives. You know, maybe the kinds of services that would be really good for us aren't available to us for a number of reasons. We live in a small community, or there are financial barriers, right? Or we're at a time in our lives where we just happen to have more responsibilities than we will at other times in our lives. You know, maybe we can have it all, but not all at once. So, you know, I think really knowing our context, knowing our community, is a really important part of that. So when we do social prescribing, doing what we would call community asset mapping is a really important part of it. Knowing where we can send people, or, you know, suggest to people what is the menu of options available to you. And if it doesn't meet your needs, can we use community development principles to build you what you need? So if you're a brain injury survivor, we had an example of 2 brain injury survivors who were needed to connect with someone else who had a similar experience. Were well supported by their families, but those families didn't really know what it was like. They got connected for a cup of coffee through social prescribing, and then went on to become the co-leaders of a new group for brain injury survivors in their small town that didn't have this resource. And again, it's the giving back, the volunteering that's been very good for them. And it's the creation of a whole new resource for other people too. So those are the kinds of creative things we can do when our environments aren't quite matching up to what our needs are. And students are doing this all the time through campus clubs and communities where you're making the road by walking, you're figuring it out. And so, you know, if you're inclined to do that, if that's something that speaks to you, it's good for you to try it out. Yeah, if you're involved in clubs and activities on campus or in your community, or you're otherwise connected with people, you're probably already doing a lot of this stuff informally or formally, but not thinking about it as part of your health plan. But think about it as part of your health plan. Think about it as part of your self-care and your community care, because as I said, some of the other things that are healthy for us tend to come along when we can do that first step of making that good social connection in a way that is healthy for us and supportive of other people. I think I'll just say that, you know, social prescribing isn't yet part of our mainstream health system. So if you go to your healthcare provider, they might not be able to support you with this as much as they'd like, but they do tend to care about social determinants of health and want to be able to take action and are increasingly interested in supporting loneliness. So, you know, if you feel like you're facing this in a really significant way, it's still a good idea to talk to your healthcare provider, because they can help you in a range of ways and help you make a connection. But it also starts to tell them that there's a growing demand for this kind of work. And we're starting to see it as part of what we think of as health services. So, you know, if that appeals to you, consider talking to your healthcare provider or your healthcare team about it. If you don't want to go through healthcare, you don't have to. There's lots of other ways to connect with what's happening on campus and in community services. And if it still feels really hard to take that first step, right, like joining the club, making that first effort, that's really the hardest part. So, you know, find your one friend or one connection, and see if you can agree to do something together. Go for a walk together on campus, or maybe jointly sign up for one of those activities, and see where it takes you. And don't look back.